you, Janae. Hi again, everyone. I'm Ashley. I use she and her pronouns, and I just want to officially welcome you to our third session in our four-part series on integrating health equity into sexual and domestic violence prevention. This session will really focus on implementation. I see a beautiful little typo on this slide, so I'm going to implementation. That sounds cooler anyways. But Prevent Connect is a national project of Valor US sponsored by the US Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the US government, CDC, or Valor. And I just want to start out by sharing, we have some objectives that have gone kind of across these sessions, the whole series, and it's really just focused on, you know, if I kind of like drill it down, being able to recognize places in our violence prevention work where we can integrate health equity practices, health equity frameworks. And so our objectives are all related to that. How can we translate concepts of health equity into practice, into things that we're doing on the ground? And how do we think about creating strategies and partnerships that will address multiple forms of violence and impact social determinants of health to prevent violence in our communities? So those are our objectives for the entire series, including our session today. Just interested in seeing if you have joined a previous session in this series. So we'll go ahead and launch another poll. Thank you so much, Janae. I was like, where are the polls on my Zoom? I suddenly could not find them. So we posted 2 so far. This is our third, as I've said, and then we have the 4th and final on Wednesday. So it looks like we're going to go ahead. We'll give it another few seconds, and then we'll end the poll. Okay, we can go ahead and end the poll and share those results. So a lot of you joined session 2, almost 60% joined session 1, and just a handful of you didn't attend either session. We have recordings for both session 1 and session 2 that we'll be sure to share in the chat in just a moment. But thank you so much for joining in that. I will say that session 1 was an amazing kind of overview of really exciting work happening across the state of Kansas, and session 2 was a very like skill-based, practice-based session where our presenter, Colleen, from the Indiana Coalition Against Domestic Violence, walked us through how to use a tool, and we actually got to practice that. So I thought those sessions were fabulous. Today we're going to actually hear a story, which I'm really excited about. So that's a little bit of what's to come. Oh, and this is my slide with our recordings. I'll pop the link in the chat in just a minute, but we do have those available for you. So if you've been on session 1 and session 2, you've seen this graphic. This is kind of how we are conceptualizing how we can take a health equity approach to preventing violence through creating accessible power to be able to improve the structural and social conditions that impact people's daily lives, and then ultimately eliminate sexual and intimate partner violence in communities. And so we will continue using this to kind of operationalize that. But I did just tell you what we did on sessions 1 and session 2, but I will just say session 1, we really tried to focus on how do we integrate health equity into the content of sexual and intimate partner violence prevention strategies. Session 2, we started thinking about the implementation process, but we really focused on how do we make decisions about the type of programs, about the type of strategies, about the type of prevention approaches that we actually want to implement. And that's where we started using the E4 framework that Colleen introduced us to. And today's session will focus still on the implementation process, but we'll be thinking about what are some of the guiding principles when we're thinking about implementation? What kind of methods and processes are we using? And we're excited to have the Rhode Island Coalition Against Domestic Violence share a story about how they have kind of walked through thinking through implementation and health equity. So that always reminds me that advancing equity is not just an outcome, but it's also part of the process. And so as we think about how we implement things, that's definitely the process of preventing sexual violence. And it's a place where we can also advance equity. We can apply an equity lens when people who are being most impacted by the violence are really meaningfully involved in the creation of solutions, in the creation of strategies and approaches, in the creation of implementation of policies, programs, and practices that will ultimately impact their lives. And as an outcome, we can achieve equity when a person's identity no longer predicts opportunities, outcomes, and the distribution of resources. So I appreciate this reminder that it's both a process and an outcome. But with that, I am really excited to introduce you to our speakers today. We've heard from both Cynthia Roberts and Krista Cunningham from the Rhode Island Coalition Against Domestic Violence in the past, as they've really been making great strides throughout Rhode Island in terms of increasing health equity and really leading with prevention. So I just want to share briefly that Cynthia is the evaluator for all programs across the coalition with a primary focus on evaluation planning and implementation for the Delta project. And Cynthia provides empowerment evaluation support to the Newport Health Equity Zone and technical assistance across partnering organizations. And Krista Cunningham is the deputy director at the coalition. In Krista's current role, she's really supporting the organization's operations and has been at the coalition since 2013. Most recently, Krista was the director of prevention and managed the coalition's Delta project. And like I said, I'll put some links where you can hear more about the work that the Rhode Island Coalition Against Domestic Violence has been doing around health equity in a moment. But for now, I just want to welcome you, Krista, welcome you, Cynthia. How are you both doing today? And I'm really excited to hear the story of the Domestic Violence Prevention Fund in Rhode Island. So I want to hand it over to you.
Thank you, Ashley. Hi, everyone. So happy to be here with you all. Do you want to say hi, Cynthia, before I jump in?
Sure. Hello, everybody. Great to see everyone.
All right. Well, thank you for the introduction. As Ashley said, my name is Krista. I'm the Deputy Director at the Rhode Island Coalition Against Domestic Violence. I use she, her pronouns, and really feel so fortunate to be here to get to tell this story and share about our work. And do that alongside Cynthia, who I've worked closely with. We've both been at the coalition about 10 years. We started just within a few months of each other, and I've learned so much from Cynthia and have been privileged to work closely with her over that time. So it's always fun when we get to collaborate and co-present. I'm called in, so hopefully my audio will be clear, and I will try to go slow for the captioners. But if for any reason I have any technical difficulties, feel free to flag it if my audio is coming in and out or anything like that. All right, so I can move these slides forward. All right, orienting myself to multiple windows up, but we're going to jump in. So we wanted to share that, as Ashley mentioned, we'll be telling a story today to illustrate how we've integrated health equity into our prevention practice and approaches at the Coalition Against Domestic Violence in Rhode Island. Storytelling is really present in our field and related fields right now, at least lifted up as something we should be thinking about and spending time on. Obviously something we've all been doing as humans for forever, and certainly not anything new to our movement. but we're seeing it a lot. For example, the Rhode Island Coalition just was selected to participate in the National Resource Center on DV's second storytelling cohort after participating in their storytelling institutes over the past few years. So we're really excited about that. And I wanted to share, this is how they describe their storytelling institute. Can you remember a time when you were impacted by the power of a captivating story? Facts and numbers are often disregarded, but compelling stories evoke emotion and propel listeners or readers to act. Stories honor diverse cultures, identities, and lived experiences. They bring us back to the foundation of the domestic violence movement, the roots, the voices of survivors. So thank you, NRCDV. We worked with NRCDV to create an infographic in the past year or so about our pay equity and economic justice focused prevention work with preventionists across the country, and took a storytelling approach to develop and produce that tool also, and I'll put a link in the chat. The theme of the American Evaluation Association's annual conference this year was Power of Story. And we're participating in Restoriation alongside 22 other state and territory coalitions, which is a national needs assessment project where we're collecting data through storytelling, journaling, and collaging to understand the collective experience of our advocacy workforce over the past few years, particularly the impact of COVID-19. So those are just a few examples of how it's really present for us in our work right now. And we always feel fortunate when we get a chance to tell stories of our work, because it welcomes that pause and reflection and helps us articulate how our strategies have unfolded and what we're learning from them. So as Ashley mentioned, we're going to be focusing on Rhode Island's Domestic Violence Prevention Fund for our story today. This was a state funding source established in 2016. You see the graphic on the slide. We are currently circulating our request for proposals for the upcoming funding cycle. So that's a awesome graphic our comm team put together to help us get the word out. But before we jumped in, we wanted to share a little bit about how were we at a place of even advocating for the legislation that created this fund. What was the context in Rhode Island and at the coalition at the time? And so we know this work doesn't just happen overnight or pop up out of the ground. We have to build it over time, and it's very multifaceted and complex and has a lot of people and organizations and community members involved. And so we really wanted to point to our primary prevention work, including our Delta funded work, which we've been fortunate to receive that funding since its iteration in 2003. So we've been building for 20 years. At the time this fund was established, it was about 13 years in. We've also been developing our organizational culture as an aspiring anti-racist, anti-oppressive organization for over 2 decades at this point. So again, about a little less than that at the time we were advocating for this fund. And the health equity zones in Rhode Island were also established. Was it 2015, Cynthia? That's the date I have in my mind. So right around that time too. And so we wanted to share this because how we're doing our work and how we're approaching it and understanding the need to move upstream to address root causes of violence was very present when we were advocating for the Domestic Violence Prevention Fund. Also, as Ashley mentioned, Cynthia's role as our evaluator, so really having an embedded, integrated evaluation approach. So a constant cycle of action, reflection, and then integrating those observations and lessons learned, which has really served us as we've done the work of the Domestic Violence Prevention Fund, which we'll talk about in a little bit. We had formed our leadership team for prevention under various names. It's now the Rhode Island State Leadership Team for Intimate Partner Violence Prevention back in 2006, early on in those early Delta years. And we've been working with many colleagues across sectors and organizations, including our rape prevention and education colleagues, who we know you'll be hearing from in the next session in this series. So we wanted to acknowledge them and lift them up. But really, this is where this work was, what it was building on, where it was born from, this understanding that how we do our work is as important as what we're doing, and that systems of oppression are the root causes of violence. And so we needed funding and resources and structures in the state to be able to operationalize those values and get resources to the community. Cynthia, anything you want to add on this piece before I jump into the specific story?
I don't think so. Thanks.
All right, so let's change slides on both screens here. Okay, so we set out to create a funding source in Rhode Island that would focus on primary prevention and creating state funding for addressing the problem before it has a chance to start. And so we advocated for 4 years to the Rhode Island General Assembly before the fund was established, before the legislation was enacted. And we have on this slide, we're talking about on this slide a little bit about narrative change, but maybe not in the way you might expect. Where we started out, those top images with nature photos and calming photos, and we always talk about root causes and changing the soil and making healthier soil so our trees and healthy relationships can grow up out of that. And so that's really where we started with our campaign, our messaging campaign to establish this funding. And a lot of language around our future depends on the funding. And so we weren't getting a lot of traction that way with decision makers and policymakers, and realized with some new communications staff coming on board and assessing what we had done and how we could shift moving forward, that we really needed to create more urgency around the problem. And so while we were talking about prevention, we needed to share more about how the issue of domestic violence was impacting people right now and why we need to end that in the future. And so those bottom graphics were the campaign that ultimately we were running during the year we successfully were able to pass that legislation. And so you see that ticker where we would post every day or every couple of days with the number of children who were present for domestic violence arrests that year, with the messaging that we can't afford to wait. And so that number unfortunately steadily increased throughout the year. And then when we reached the 500 mark, we held a highly visible event at the State House. And you see a survivor and her children to the left there. And that is someone who's part of our survivor task force, SOAR, Sisters Overcoming Abusive Relationships. And they work on social and systemic change for domestic violence prevention. And so all of these things, contributed to that success. But this was the campaign that really caught the attention of lawmakers and the media and created that sense of how urgent this problem is and that we need more resources to address it.
Krista, could I ask a question?
Yeah.
Yeah, it's really fascinating that you all started out in a way that I think makes a lot of sense probably to all of us in this room. Like, these are the things that we conceptualize as being like important to violence prevention, and then where you all ended up that actually like spoke to people and resonated with people in power. And I'm wondering, how did you get a sense that like you had to focus on the children and creating that like immediacy? Did your comms people like research that? Was it just kind of like a guess and it ended up working? What did that look like?
Yeah, that's a great question. So of course, multiple things, but we do have a group that's called Polycom. And so every year our policy team and our communications team, as well as other staff, are part of that committee or working group. And they develop the messaging strategy and the talking points for that year's legislative campaign and our priorities. And so from that group, having worked on those previous campaigns, and then also just interacting with decision makers, with the materials, not getting hearings, the session passing us by without seeing that traction. And then I remember specifically a new comms staff person coming on, and we had many early iterations of our first ever prevention publication, which isn't featured on this slide. But we also, around this time, we were creating, okay, we need a resource if people ask, what do we mean by primary prevention? So we had created a little booklet. And from those early drafts, the new comms manager said, there's no urgency here. Like, why would I care about what I'm reading and the need for prevention? Early in these pages, we should define domestic violence, define its impact and its prevalence, and then move into the so what can we do about it? So it was many different things, but different folks, coming in and lending their perspective on what might be effective, and also seeing how the existing messaging was or wasn't resonating. But I think that Polycom group is sort of the think tank that reflects and assesses what's been successful and then determines how to move forward. All right, so finally, we were able to get this law passed in the Rhode Island General Assembly in 2016. And so it was established through the state budget. So it's a bit of a twofold, where there is a law in the books that says this fund should exist, and it needs to be preserved in the state budget each year in order to have the funding actually exist. So we have to continue to advocate for it to not be cut, and hopefully over time it will also be increased. And then sometimes you'll see Deborah DeBaer's name in front of the Domestic Violence Prevention Fund title, and that is because in 2018, it was renamed the Deborah DeBaer Domestic Violence Prevention Fund in honor of our longstanding executive director, Deb, who served the coalition for 22 years before moving on to the national network to end domestic violence. And so we like to lift that up when we get a chance. So we've established the funding. We've been identified as the administrator of the funding as the Coalition Against Domestic Violence. And the legislation also named, fairly vaguely, an advisory committee, and who should be part of that advisory committee to determine how the funding actually gets dispersed. And so I'll turn it over to you, Cynthia, to share a little bit about our next steps from there.
Thank you. I just wanted to say at this point in the story that it's really cool to hear this story, even as somebody who's been part of it. We don't really do this very often, sit back and kind of create a timeline like this and really give details and actually tell a story that makes sense often. And I bet a lot of our partners and colleagues on this call can relate. You're just like running after one thing to the next. And a lot of the reporting is often for funding stakeholders. And so it's almost a luxury and a privilege to have a chance to create space to tell a story. And I just wanted to remark about that because it's really something unique that we don't really tend to do very often, and express gratitude for the space to do this. So as Krista was saying, we got to the point where we got the funding finally after all those years of diligent advocacy and strategy. And then came time to craft the request for proposals and design the whole process of what that would look like. And folks on the call, I see some of our Delta colleagues and others that I've seen on other calls. Folks may know our executive director at the Rhode Island Coalition, Lucy Rios. So she was the first director of prevention with our Delta funding, and now she's our executive director. And she took the lead on crafting the RFP. And I had a conversation with her about some highlights that stood out to her. So I'm happy to share some of those recollections woven into this story. So one of the things that was unique is that with our state leadership team, we had advocates based in the community who wanted to see the domestic violence prevention money go more broadly to the community. Because what might have been typical would be we'd get the funding and then we would pass it through to our member agencies. But our leadership team was really strong on wanting that funding to go more deeply into the community. And that really aligned with our anti-racism values of who, and our health equity focus of who we were centering in the work. So, pardon me, the RFP was an opportunity to articulate to our own movement, to ourselves at our coalition, our close partners, our emerging and existing community partners, that we were walking the talk, we were taking the money and really trying to get it to communities most impacted by domestic violence. So with that RFP, we also were plugging into, as Krista mentioned earlier, the health equity movement that was happening in our state. So there was a lot of appetite and a lot of education among many of us working in public health sectors to work in this way, focused on social determinants of health and prioritizing populations that were experiencing the biggest impact of violence. So the RFP was written, and as Krista was saying, we had a, I just want to see if I need to move the slide one quick second. Okay, no, not yet. We had the RFP written, and because this was a new process and we had folks who were supposed to be on our advisory committee, it was also a very emergent situation. We didn't know who of those named departments in the state would actually end up being champions for this. So that in and of itself was a process to engage the advisory committee. And we had very much truly two-way and collegial approach to this. So they weren't a rubber stamp committee. They really helped. We did not have a voting voice on deciding who would ultimately be awarded. We could only advise them. And we were trying to help them real-time learn about primary prevention, because at the very beginning, the impetus was to award applicants who in some way, shape, or form were working in domestic violence, because that's what people could relate to. But then we, over the course of actually funding folks, could show ourselves, our own community of funders, what it could look like to actually work on the social determinants of health. So kind of backing up the way the RFP was written, it was designed to prioritize communities of color, LGBTQ plus youth, two-spirit and gender nonconforming youth. And then after one cycle of funding, we also received feedback from the community to prioritize youth with disabilities. And some of that was informed largely through our YRBS data, when we saw who experiences disproportionate teen dating violence. So it was those populations that I just mentioned. So it was truly a learning process to get to the point where we weren't privileging people who in some way were already working in domestic violence. And I know in an upcoming slide, Krista is going to talk a little bit about who the grantees have been. And I just am checking my notes for any other highlights that I wanted to mention about the RFP process. Yeah, and the fact that one of our, Rhode Island was the first state to pass a teen dating violence law requiring our schools to include teen dating violence education in our, in the curriculum. And the champion at that time, Ann Burke, for whom the law was named after her daughter, Lindsay Ann Burke, she was a really big advocate for having this money go out to the communities. And that gave us the support to really move our prevention work into the community. And as folks probably know, and I know there's some Delta grantees on this call, there can often tend to be a siloing of the prevention work and the intervention work. And it's like an ongoing challenge to try and integrate that primary prevention thinking and movement into our mainstream domestic violence movement and work. And this process of awarding the grants and educating the different members of the committee and ourselves about what primary prevention can look like has been a big facilitator for moving primary prevention across teams in our at our coalition and within our movement. And then I'm just going to pause and see if Krista has any points about the RFP that I haven't mentioned that you would want to highlight.
Not about the RFP, Cynthia, but I'm just reflecting on what you're sharing. And I was not either at the, well, I was at the coalition, but not part of those conversations when the funding was actually available and how it was going to be awarded. And so I'm thinking of, I don't think we've mentioned the amount of funding. So it was $200,000 and still is. We got a small increase. We got another $10,000 the past 2 sessions ago, I think. So a little bit higher than we were originally. And that's not, as we know, a lot of money. But what we've been able to do with it is, as we're going to share, is so impactful. And I think, of course, domestic violence agencies and systems also are never funded enough, and that's part of why we, also need to focus on prevention, because we'll never end the problem. There's always going to be so much need, and that's what we're trying to decrease. And so I could see that amount of money easily getting absorbed into the existing systems, and of course having an impact on the people that they're able to reach with those funds, but really just becoming part of the status quo in the existing systems, knowing how important that work is also, but then being able to set that money aside and be really clear for it to be resourcing the community in these newer or at least less familiar in Rhode Island in those new ways. So just reflecting that back to what you shared.
Thank you. I think that's good for this part for now, if you're good to move forward.
Great. Thank you for telling a little bit of that story. And so this language comes from the request for proposals. It happens to be circulating right now in Rhode Island, so we're excited. In a couple of weeks, the due date will be here, and we'll get to see who's applied for the next funding cycle. And I linked that in the chat. And so we named some of the goals as being to increase the number of schools, community groups, and community-based organizations engaged in primary prevention of intimate partner violence and multiple forms of violence. As Cynthia mentioned, to address disparities by prioritizing strategies that center the experiences of those most impacted by intimate partner violence, and then lifting up these 3 priority populations, which Cynthia mentioned are young people of color, LGBTQ+, Two-Spirit and gender nonconforming young people, and young people with disabilities. So just reiterating some of what Cynthia shared as what the RFP centers. And we have been working towards and achieving those goals. So this slide is intentionally crowded, needs to be split out into 2 slides, probably next after the next funding cycle, but shows all of the local organizations and groups in Rhode Island that have been funded by the DV Prevention Fund since it was established. And in addition to this list of organizations, we can share that 37 projects have been funded. So some of those projects were led by the same organization who reapplied for different years. And it's really exciting and just amazing to see what we've been able to build over time with, again, not the largest amount of annual funding, but knowing that the funding is only one piece, and the relationships, the power, the access to resources, the knowledge, and the networking that has happened over the years this work has really taken on a life of its own. These projects are listed on our website, and I'll put the link in the chat once I'm done with this section, so you can see not only who's been funded, but what their project focused on. So recently we convened the funding advisory committee that Cynthia described to give them an update on how the grant program has been going, lessons learned and reflections, and to gear up for this upcoming funding cycle, which the grant making process will be underway in November. And so we pulled from some of those slides to share some highlights with you all. And it also just shows kind of the kinds of updates we share with the committee along the way. And was another opportunity for us to pause and say, okay, what is happening with this work? Where are we? What do we want to lift up and articulate along this journey? And so we have noted that we're seeing fewer to no applications for direct service or crisis intervention, whereas early on in the grant program, there would be a handful of those each year for each RFP. We're also seeing an increase in the general number of applications we're receiving, so more proposals and more proposals focused on prevention and aligned with the request for proposals criteria. We're seeing the proposals also more likely to focus on community and societal level prevention and not only on individual and relationship level prevention. So we're seeing that shift as well. And not only in the proposals, but then in how the strategies unfold once the projects are funded. And then something somewhat surprising to us is that recipients really want more time together and more time with the coalition. And so knowing that the awards are fairly small, community-based organizations are often stretched very thin with maybe a small number of staff. We haven't wanted to burden recipients. And so we have designed like reporting and our community of practice meetings to be as light of a list as possible while still, adding value and understanding how the project is going. And so we heard consistently from funding recipients that they want more community of practice meetings, more check-ins with the coalition staff, more time to celebrate together, so like a final end of cycle celebration, and more time in person. So we really were focusing on limiting the burden, but and even with reporting, we offered, we've in recent years, I think it was prompted by the pandemic, made oral reporting or written reporting an option, whatever was best for the recipient, to have a meeting and walk through the questions or to write up the report. And we had several folks want to do both this time around and want to get it down in writing for us and for their own benefit, but then also have a conversation so they could share with us in community what the project looked like. So that's really exciting. And we didn't know what to expect when this funding became available and we were going to administer it. We didn't know how much staff capacity that would take, what the community members would be interested in, what the needs would be. We had an idea of what the structure could be in terms of convening those communities of practice and learning together, but we didn't know how receptive folks would be to that. So it's really cool to see how it's grown and then to hear from folks what they want more of, and that people just want to be together. They want to be learning together, sharing and troubleshooting together, and they really want to be building beyond any particular funding. They want to be building a prevention movement and ecosystem together.
Krista, I'd love to add that I put it in the chat, but I saw Ashley's comment about she liked the idea of the oral reporting. And I feel like what it did for us is, even though we had been convening them throughout the year at different points for technical assistance and check-ins and things like that, being with them either on a Zoom call, it was usually a Zoom call, while they reported back to us, gave us so much more detail, and it really did create a community of learning happening in that moment. And I feel like it's informed our next step so much in terms of what we built into the newest iteration of the RFP. And I just don't think we would have learned that had we only received a report, even knowing like pretty much about what the work they were doing. It was having that reflection time together, and it was very exciting too. I felt like we could just understand their work so much better through that kind of coming together. And as Krista was saying, it was originally offered to prevent burdensomeness of writing a report. And then a number of people wanted to do both. So that was really interesting to learn.
That's really neat. Thank you for sharing about that, because I also imagine it was probably a really good opportunity to put into practice being able to talk about and communicate about our work, because that can be, something that is a struggle, because we don't always get that space, right? Especially when we're just like having to respond to things in writing. So that's just, I feel like there's so many reasons why that would be a valuable option. So thanks for sharing about that.
Sure, thank you both. Now we get to share the exciting part of sharing who's received the funding. And as you saw on that slide, many other organizations, but we chose a few to highlight today. The first is Progreso Latino. They are also an affiliate member of our coalition, which is very exciting. And that also happened around the same time that the DV Prevention Fund was established, where that new membership category was established and rolled out, and where that's also an area where we're able to build with community-based organizations and culturally specific organizations. So Progreso Latino was funded for a project at the implementation project level, which is a larger amount of funding for a longer period of time compared to the micro grants. And they received 2 cycles of that. So for 6.5 years received that funding and have really done so much to build with the community. Their project increases community connectedness and focuses on mobilizing adults to create social and policy change through the Adult Social Action Committee. And so that committee builds folks' leadership skills to become involved in issues that are impacting their community and families, specifically through policy change work. And so they are partnering with local policy coalitions. They're active in state level policy campaigns. They've had elected officials come speak and host events and come to their meetings to educate them about what issues they're leading on and getting input from the community. And they've been really involved in a few recently successful campaigns, including driver's licenses for all, which I think was like an almost 20 years in the making initiative in Rhode Island, finally passed recently, and health insurance for undocumented children. And so I think that also has just exponentially grown and gained momentum as folks were able to experience like the demystifying of these processes and feeling like they do have a place at the State House, and having an organization help them with transportation, language access, and that educational and empowering piece around, the language that's used, how to decode a bill, how to prepare your own testimony, and then doing that in community and in partnership with existing coalitions and other organizations. So tapping into that ecosystem and network. So this work has, as I said, has really built over the years and is really grounded in that piece that you shared with us, Ashley, during planning, and that baking it in health equity resource around building access to power in order to address social determinants of health as a violence prevention strategy. So love that work, love to see it, very exciting. Here's another project highlight, this one by the Partnership for Providence Parks. And so at the height of the COVID-19 pandemic, this project actually had to pivot both due to a leadership change. Initially, Providence City Arts for Youth was funded, and then had a leadership change and a staffing transition in the midst of the pandemic. So Partnership for Providence Parks was another lead partner on the grant. They took over as the lead recipient. And the initial project was no longer possible because of social distancing and stay-at-home orders. And so they had to pivot and say, okay, well, what are we going to do now? And so the project supported the development of art kits for young people in Rhode Island. These free take-home kits were filled with art supplies and distributed at free meal sites during the summer. Making the kits available helped with the effort to get the young people to the meal sites and provided children with meaningful art making activities while stay-at-home orders were in effect. And supplies included bilingual drawing sheets created by Providence City Arts, so they still had a role in the project, created by those educators, and coloring sheets promoting healthy relationships, which we helped provide. So that's an example of a micro grant, which is a lower funding amount over a shorter period of time. That's meant to infuse resources quickly to meet community needs. I think I skipped one. There we go. Another highlight is the Alliance of Southeast Asians for Education. Oops, I missed 2 words, Rhode Island. That's their full acronym. So the Alliance of Rhode Island Southeast Asians for Education, ARISE. And so they have been funded for multiple community microgrant cycles over the years to develop Hidden Lotus, which is based on the evidence-informed model Girl Circle, but is a culturally specific gender inclusive model. And they adapted that curriculum to create a trauma-informed space for young people of color, and participants build leadership and social emotional skills and raise awareness among their peers about dating violence and healthy relationships. That program initially focused on high school aged youth, and they've since developed Junior Flames, which is for middle school aged youth. It's very much a youth-led space with adult allies providing resources and a sounding board, helping support their ideas for their peer education media campaigns, and really letting the young people shape what they want out of the space. Year after year, summer after summer, it is, there's a waiting list for the program. They don't even really have to promote it. The young people are like, when are we doing this next? And please, can I be part of it this time? And so they've held multiple sessions or, cycles throughout the year when it was originally a summer program, and then developed the additional programming for middle school aged young people. And then Youth in Action. Okay, so here I just wanted to check the chat, Ashley, because this is, the next slide will be our video. We're gonna share a feature video about Youth in Action. And so with this is another example of an organization that was funded during several different funding cycles for community microgrant funding. And so they created the Ending Domestic Violence Youth-Led Action Group. So they had lots of different action groups with different topics, which you'll hear about in the video. And the young people wanted to create one focused on ending domestic violence. And so this action group focused on developing young people as peer leaders, into peer leaders who educated others on the problem of teen dating violence and ways to prevent it. So among their peers, among adults and educators. And then out of that was born 10 Young Men, which is modeled after the Coalition Against Domestic Violence in Rhode Island's 10 Men strategy. And so that's really exciting. It's fairly new work that has been piloted, and that focuses on engaging, educating, and mobilizing male-identified young people to end intimate partner violence. So we'll talk a little bit more about that at the end of the presentation, how the Domestic Violence Prevention Fund has had all of these ripple effects. And although the microgrants are fairly small awards over short amounts of time, some organizations have consistently been awarded that funding and built around it to build a lot of momentum, especially these youth-led and serving organizations, to see how they've been able to use and leverage these resources to build out what young people are asking for and what they want has been really exciting. Okay, so we'll stop sharing and then reshare to make sure the audio comes through. Anything you want to add, Cynthia? I threw this video out there with not a lot of heads
Yeah.
up. So thank you, Prevent Next team.
One question I have for the people on the call is, at some point, if folks could let us know what parts of this story feel like useful to you in your work. I'm just curious, like what pieces are landing for you and how it's kind of like making you think about things. Because I saw, for example, one person besides Ashley, liked the thing about the oral reporting. And I'm just curious, like what other things are people like are landing with people. So I'm just planting that seed for later.
Thank you, Cynthia. Yes, very curious about that too. So we have this awesome video to share about youth in action. This came out of our Voices of Change video series, which was actually funded by our Delta supplemental funding, which was funding provided, was available for Delta recipients to apply for during the pandemic to meet COVID-19 pandemic-related prevention needs. Another example of our health equity practice, Lucy, who Cynthia mentioned earlier, and Cynthia and myself a little bit, but I was very new to the Director of Prevention role, so I was more in learning and listening mode, made the decision to utilize half of that funding, which was $200,000, to directly fund the organizations that participated in this video series. So that was ARISE, who I just mentioned, the Alliance of Rhode Island Southeast Asians for Education, Progresso Latino, Sistafire, and Youth in Action. So those are 4 community-based orgs in Rhode Island. So 50% went to them directly, about $25,000 per grant, and then 50% went to this storytelling project, plus some communications messaging training for us and our staff. So that's how we utilized that funding. And the series set out to tell the stories of these Rhode Island organizations leading transformative change efforts during the pandemic, to offer examples of prevention strategies that center those most impacted, and was a collaboration between the 5 of our organizations. I think at the last webinar we had the privilege of presenting on, we shared the collective video, which shows all of us telling a collective story. And so we wanted to have an opportunity to share this one that focuses on youth in action. And 3 of those 4 partners were DV Prevention Fund recipients. So we had already started to build with them, and it felt like it was, it made sense to use those resources to directly fund those organizations during the pandemic, and also gives us now the opportunity to share stories from the DV Prevention Fund recipients. So without further ado, I have slide share capabilities. Do I have play capabilities? Thanks.
Yes, but I can play it.
Perfect. Thank you so much.
Yeah.
My name is Olubumi, and I'm the Program Director of Youth in Action. We are a multi-generational, multi-ethnic, multi-racial community. We bring our heritages, we bring our traditions, we also bring the fact that we come from very different home lives.
I'm Aisha Isabel. Being here at Youth in Action, it allowed me to understand who I was and the role that I play in these different groups. We don't just throw youth out there in the community. We start with having them learn about themselves and learning about who they want to be. I am not just your daughter, I am not just your student, I am not just this person that you can mold. I'm this person who has to take time and understand what does and does not work for me and how I'm feeling as well.
We have conversations about who are you, what are the internal aspects of your identity, what is your personality, what are the external things of your identity, and how does that all come together to create a social location, and then how do you apply that to the context and the time with which you are living right now.
I truly believe that if it wasn't for the conversations and lessons during my core year, I might have never gotten to ask myself these questions and understand myself like I do now. Youth in Action continues to provide a space for me to do things I would have never imagined, providing platforms for youth to talk about topics happening right now and feel safe to process and create change.
After-school programs are effective for youth just because it allows them to mold it to however they want it to see fit. You go to school, but that's a system that's already made for us, and there are choices that were already made for us. And then some people go home and there are choices that are already made for them. And so after-school programs just allow people to really figure out what is it that you want to do today, or what is your purpose here, or what is it that you want to see from today.
We start the conversation with where they are, and then from there we provide them with the context and the historical knowledge to really understand why it is they're experiencing what it is they're experiencing.
Most of our work is surrounded by who do you want to be in this community, and what is your role here.
We have 4 action groups this year. I'll start first with the Youth Action Board, which is a group of students whose mission is essentially to address and discuss youth homelessness. So, okay, yes, this is how we're addressing homelessness, but let's add a youth in it, and then how does that change the conversation now that I'm here and now that you're talking with me? Our next group is our Outdoor Equity group, and that group's mission is to create spaces for Black and Brown young people to feel comfortable and feel safe in the outdoors. Why don't brown and Black people go on hikes? Why don't they feel comfortable going kayaking and canoeing? And how can we make these spaces safe spaces? Then we have the Language Justice Collaborative, and that is a group of students whose mission is to work with multilingual learners and English as a second language learners. And then lastly is our Ending Domestic Violence group, and that is a group of students whose mission essentially is to investigate and interrogate the ways in which young people experience domestic violence and abuse.
For Domestic Violence Awareness Month, we were able to host a workshop with a set of activities and lessons. It was a pretty heavy topic because we were talking about abusive relationships and certain statistics about domestic violence, but being trusted with that topic, that was really important for me.
Right now we're in the phase of informing ourselves so that we could develop a workshop so that we could take it out in the community.
So all of these action groups try to create vulnerable spaces for folks to feel safe and feel brave and feel comfortable. They leave the space with an awareness of not only themselves but also the others in their networks, and how they can be more empathetic and how they can problem solve together.
At the wilderness retreat, there was always a time where there would be a fire roaring, everyone would just be sitting around the fire, where people would just say things that they were thinking about and say things that affected them. That taught me an important skill that my opinion matters, and that my opinion is something that people want to listen to.
I think my favorite memory was when they took us out into the wilderness and we went into this big field, and it was dark so that we could see the stars. And that was my favorite absolute part, because being from the city, because there's so much lights from the towns and stuff, you don't see the stars as bright. Being there, laying down next to people who I didn't know, we only met for 3 days, laying down with them, it felt so safe and so comfortable. And that's when I realized that Youth in Action is actually my safe place.
I want to continue to go on and provide space for young people, because space was provided for me, and I was very much so raised in that community where you reach back for people and bring them forward with you. My ideas were always listened to at Youth in Action, and I know that providing that space and just being someone to open the door so that young people can lead the way is what I want to ultimately do with the rest of my life.
What we do here is really create these spaces for youth to be their authentic selves and practice being the leaders and adults that they're going to become. And they already are leaders. It's just supporting them, really understanding and how to leverage their power.
Youth in Action is a space where you can have fun and you can love on each other and you can love on your community in the ways that you know how.
One special memory from Youth in Action is honestly staying, programming went into 6, and then just staying for 1 or 2 hours after to just be with family, be with people who care.
We hustle and we stick together. So I think it's the idea of no one's left behind. A situation will happen where you're I'm not capable of this. This is out of my hands. I don't know what to do here. I'm not the most informed person on this. How we build resilience here at Youth in Action is that we remind youth here that you are here for a reason, and all of you deserve a place on this world, and if you didn't, you wouldn't be here, period.
thanks, Janae, for presenting that for us and toggling tech support. Much appreciated.
No problem.
All right, so I'm just going to pause for a moment. Thank you so much for what you shared in the chat, Ashley. Wondering if others have reactions or questions after watching the video.
Well, Shaquana said that is an awesome video.
Thank you.
And Lizzie agreed. Oh, and here's a question about how did you go about selecting the youth for Youth in Action? Did you all play a role in that?
Yeah, so Youth in Action is a standalone community organization, and they're located in Providence, Rhode Island, but they serve young people from all over the state. And so it's my understanding that any young person who wants to be involved in their work and attend their after-school programs are welcome. And then for the video project, that was really up to Youth in Action of who they wanted to be part of the video conversation. And as you saw, we were doing some of this during the pandemic. And so we had some Zoom conversations as well as some in-person filming opportunities. Thanks, Cynthia. Cynthia just put the website in for Youth in Action, the organization. They're doing really incredible work, as are many of the partners that we are privileged to get to work with through the DV Prevention Fund. And we like to lift up that through their Ending Domestic Violence Action Group, for example. It's not only that there's educational workshops being held with the young people and developed by the young people, it's all the process that goes into that around empowering them to lead and to decide how to reach their peers with these messages, feeling empowered to train adults and share with adults what change they want to see, and just the where that work is situated in this broader organization around leadership development and social cohesion and collective efficacy and all those protective factors that we talk about. Connection, right? Community connectedness too. Cynthia and I really love that part about the wilderness retreat where they're talking about just that safety and connection and belonging that they feel together, and then the connection to nature. All of that is really amazing. So the DV Prevention Fund gets to fund a small part of that, but then the partnership we get to build around that and find other ways like that Delta supplemental funding to resource that work is kind of like that bigger story. You want to add anything, Cynthia, before we move on?
I just put in the chat that Youth in Action is a pretty old organization. It's at least 25 years old. And so the youth leaders have also gone on to become, like adult leaders in our state. So they have like a really powerful reach, both through their youth voice and for folks who have like gone on to build careers in the state. So they definitely have a presence in Rhode Island.
Thank you so much for adding that. Oops. There we go. So we just have a few more slides. I'm cognizant of the time and want to have some time for questions if folks have any. I saw one came through in the chat. So we'll just finish these out. As we've mentioned along the way, this grant program has given us the opportunity to build meaningfully and authentically with community partners, particularly those led by and serving those most impacted by violence and its risk factors. This image is of an event we held in March, releasing our new prevention publication, which we'll plug at the end of our slides. That is Progreso Latino's Adult Social Action Committee, pictured in the top right with Lucy Rios, our executive director, and then the room full of prevention partners. There are about 50 folks in our new training space, one of the largest and first in-person events we've held since coming back from working fully remote during the pandemic. And this publication really reflects what we've been learning and building together alongside these funded partners, even down to language interpretation. So working with the Adult Social Action Committee, inviting them to our events, including our Community Advocacy Day at the State House. Not only is Progressive Latino reminding us and advocating that we need to have language access for our materials and our events, but we also, are aware that folks who need Spanish language interpretation, for example, are going to be in the space. And so being responsive to that direct advocacy, but also being responsive to the folks we're in community with. So this work has really helped us build beyond this particular funding source. And we've also been able to partner on other funding applications, which I know, Cynthia, you're going to speak to. So how else can we leverage our role as a state coalition to hold some of those administrative pieces that might be too burdensome for very small organizations to apply for, or that they might not be as competitive for on their own. So we've been able to do that as well to get more prevention resources to the community. I don't see the arrows anymore for some reason. Could you advance the slide for me? There we go. They just popped back up. Thank you. I'll turn it over to you, Cynthia, for this one.
Thank you. And I'm also being mindful of the time because I know we want time to discuss. So I just wanted to give like a really big affirmation to Krista for her stewardship in so much of this work. Before she was the director of prevention, she worked on our comms team. So she brought so much of that acumen into the director of prevention work, and the Voices of Change video series. Really, it was created during a very chaotic time during the pandemic. Just thinking about it feels so emotional, but it's hard to like imagine ourselves back in that time, but it was the peak of the pandemic. So when we got the supplemental funding out of accountability with our community partners and especially frontline communities, that was really why we had to rapidly disseminate the money and make rapid decisions. And we knew we wanted our values to be aligned. So that's why we shared like so much of that money directly with the communities. And they told us through meetings with them while we were writing our application for the money that their families were dying at disproportionate rates during the pandemic. And they were so busy doing crisis work that they were not able to apply for funding. Many were small frontline organizations. So eventually our partners told us that they wanted to be able to tell their story of all the work that they had been doing during the pandemic and how, like, what a toll it took. And they wanted to be able to use those videos for leverage to demonstrate all the work that they were doing. So those videos serve that role, and I wanted to name that because it was during a time when it was hard to know how to do things. And a lot of what was done had to be done really carefully and in a new way because of the danger of the pandemic. So I wanted to lift up that process because it was a really thoughtful, and it really brought us closer to our partners too. And that was Krista's leadership really that helped make that happen so well. So I wanted to name that. And then moving into this slide about, yeah, I see what Mark said. Yes, it is truly heartbreaking. Around emerging connections. So the Domestic Violence Prevention Fund, as was mentioned earlier in our talk, planted seeds for us to be able to work even more deeply with two of our grantees, Youth in Action, that was implementing the 10 Young Men program, and then the Refugee Dream Center that's implementing refugee youth dreamers. And we were able to put together a really compelling proposal for OVW based on that authentic work that we were co-creating with those two partners. So that just keeps taking the roots of this DVPF work even further with that OVW funding. And then 10 Men, it has a lot of overlaps with the DVPF across various very small groups, faith-based groups who ask for funding to do engaging men work in their faith communities, for example. And then currently the Greening Urban Spaces work that we're doing has overlaps with our 10 Men work and folks who came through the DVPF. So it's like our strategies are really starting to be braided together. And that is also part of what we've been aspiring to do, is to, as I was saying earlier, not have our primary prevention work be so siloed through our CDC funding, because all of us know that it's not good to rely on one source of funding for such important work. And, you know, we can only hope that that funding continues, and we know we have to really help seed it into our communities through these various funding strategies. What else do I want to say? Oh, yeah, so that's, I feel like as far as accountability and sustainability go, these ways of diversifying and deepening the DVPF work across these other funding strategies is a way to increase that. And then I'm not sure about the SOAR task force, so I just wanted to ask Krista if you had anything to say about that, because I'm not sure.
Sure. Yeah, so the last funding cycle was the first time a member of the Survivor Task Force SOAR applied to lead a prevention project in their faith community, and that was successfully funded. So that was really exciting to see. And it's someone who speaks very passionately about the need for prevention and wanting to leave a legacy in this work for young people in the community. So that was really powerful. And Cynthia mentioned our OVW Engaging Men partners, Youth in Action and Refugee Dream Center. Both of those organizations are led by or were founded by alumni of our 10 Men program. So there's a 10 Men connection there too. And you saw in the Youth in Action video that outdoor equity action group. And so a lot of these youth-led organizations are really interested in things like tree canopy and green space and equitable access to those spaces, and all the health benefits, mental and physical, that come with access to green space. As you mentioned, Cynthia, there are folks who from the environmental justice movement, particularly in our in Newport, Rhode Island, which is where our coordinated community response for Delta is located. They are serving on the new cohort of 10 Men. So as you said, Ashley, we're really starting to see those connections just emerging and building organically through this work.
Thanks, Krista. And then moving on to the next slide, which I think is the last one. We just wanted to reflect on some evaluation highlights across all of these developments that we've been sharing with you. So some key features that we would lift up to our various stakeholders, whether it would be the legislature that ultimately funds us through the budget, or our frontline community partners who we are accountable to in our work, especially as we continue to be more like leaning more into how we want to be anti-oppressive in our work and anti-racist. And then also our DV movement. So we have different stakeholders who were figuring out how to communicate the findings in ways that make sense and that feel meaningful. And we're differentiating because the different stakeholders don't always want to know the same things. Also, as we've mentioned numerous times, the fact that this RFP of the DVPF and then its legs that go out center communities of color, LGBTQ+, Two-Spirit, and gender nonconforming youth and youth with disabilities is really the cornerstone of this work, and living into that and finding ways to do that work. We are as much changed as we are providing the assistance and the resources through our organization. We're also learning and changing together. it's transformational partnerships. Also, I already talked about the sustainability part. The piece about the narrative shift around preventing domestic violence has been really important in this work. Doing the work, learning deeply with our funded partners is helping us understand what this work actually looks like. And then it therefore helps us know how to even talk about it. And then also, as we pointed out earlier, different audiences have different stakes and want to know different parts of this work or relate to it differently. So there's just a lot of change happening with our narrative shifts and really differentiating our stories for the audiences that we're speaking with and communicating with. And then ending on a couple high notes, we do have increased capacity. We're living into that right now to do more than really like monitoring, which is kind of the way we've been doing this, because we got all this funding, but we really don't have a lot of internal funding to support all the technical assistance and training opportunities. But so one of the shifts we made was we have this community engagement position that's situated with the prevention team that's going to be reaching into the community even more. So we're expecting to see even more progress around how we work with the communities. And then all of this work is helping us de-silo primary prevention, which will increase the capacity and really promote what we're all trying to live into, which is have a world where we don't have intimate partner violence to begin with.
Thank you, Cynthia. I'm just going to share our last slide, which is the cover of our new prevention publication. It's entitled Preventing Intimate Partner Violence in Rhode Island. Together we can create safe, connected communities. And I'll put the link where you can access the full publication in the chat. It's an example of, thanks Ashley, it's an example of continued narrative change around what primary prevention work looks like and helping folks connect to the efforts that are already being led in the community. As I mentioned before, it reflects so much of what we've learned from and alongside DV Prevention Fund recipients and community partners, what they want for the future, what their priorities are. And also we lift up our anti-racist, aspiring anti-racist guiding principles as an organization. And so I think we're holding those questions going forward around what is our relationship to power? How are we leveraging it? How are we sharing it? How are we doing our work together? Not just what work are we doing, and how are we reflecting and living our values? I did include in the slides, this is a presentation we've given on the publication. So we're not going to walk through the slides right now for the sake of time, but you can click through them when you receive them after the call, and you can see it's sort of an outline of what is contained in the publication. So there's an intro, the purpose, and then the actual priorities we list up. And all of those priorities are broken down into focus areas. I think I'm clicking too fast. It's just lagging a sec. And then we include some frameworks in terms of public health prevention frameworks for folks to see where our work is grounded in, and we describe what our state action plan is as opposed to our vision document. I'm going to click through these quickly, but they will be there as a resource for folks. And yeah, this is our narrative change. We can prevent domestic violence and sexual violence and multiple related forms of violence before they start. Prevention is possible. And we have some acknowledgements in our closing slide, including Lucy, our executive director, who helped build so much of this prevention foundation, other staff, our partners, DV Prevention Fund recipients, the advisory committee, our leadership team, and our Delta community and partners. So I think that brings us to close. Do you have anything to add, Cynthia, before we respond to some questions?
Nope, I just wanted to say I put a kind of a quick answer to Mark's question about how we determined what projects to support. And then it is in our RFP, but I know we only have a few minutes left, so I just wanted to get a quick answer out to that.
Awesome, thank you. Do you want to share it verbally as well?
Sure. So when Mark asked how did we determine what we would support, it was kind of toggling between what we knew we didn't want to support. So we didn't want direct service, and we didn't want it to be specifically addressing domestic violence. It could have a component or an education or like a media community education component, but we wanted it to be more focused on the social determinants of health and supporting leadership and youth, and then promoting the implementation of our teen dating violence policy, which is like a policy that exists in words, but it's unfunded. So we wanted to try and throw some support towards that because it hasn't really been implemented very robustly.
Thanks, Cynthia.
So we have a couple minutes left. So if there are questions coming up for anyone, feel free to put them in the chat, or you can raise your hand and we can have you unmute. That's also an option. I have a question, and that is, I am really curious so through your implementation of the Domestic Violence Prevention Fund, have there been any kind of changes in the way you all have viewed prevention in Rhode Island? Anything that surprised you? What have you learned from the community who applied and received some of this funding?
That's a great question. One thing that comes to mind, which is reflected in the publication, is how much prevention is a continuum. And while communities are leading prevention efforts, folks are going to come forward and disclose experiences of abuse. They're going to need healing spaces. They're going to need resources. They want and need education about the problem, and they want to be part of providing that education and shaping it. And then we're also doing this like outer layer community level work. And so sometimes we see those as being so, separate, because particularly funders are driving like we did, right? We're not going to fund direct service because we're trying to also invest in prevention. But understanding projects are probably going to have components of many different levels of prevention, and being open to that and kind of approaching it in more holistic ways. So I'm sure, Cynthia, you have some thoughts on that question too.
Yeah, I appreciate that you brought up the thing about the continuum, because that was, I think, another transformation that happened with us during the pandemic, especially during the peak of the pandemic, when, we were forced to be responding to a crisis. And I think it just humanized our work a lot. Yeah, that whole like outer layer focus, it's like people are also people living lives in communities, and it can't be like this transactional thing. And I just feel like the DVPF, it has really promoted relationships in a really deep way. It feels like our movement is just about people that are really committed to this work together. And it's really exciting to see our partners out at different community events and supporting them and coming to our things. It's like, it has transformed my experience of the domestic violence movement in our state.
Thank you, Krista and Cynthia, for those responses. And I just want to encourage folks, as we wrap up today, if you are leaving with any thoughts about what resonated with you, I know Cynthia and Krista would love to hear any thoughts that you have on that. So I encourage you to just throw something in that chat box. But I just want to take a moment to thank you both so much for showing telling a story about what implementation can look like when we really think through how health equity is a process. So just, you know, as always, thank you for being willing to share your journey in this work. The slides are available on our website, so you can get links to everything that was shared here today. I just am grateful for you all being here and listening to this story, and do hope that it offered some ideas or inspiration. I want to thank our captioners. Thank you, Janae, for all of your support. And we hope to see you on Wednesday for the 4th and final session. We'll also be with colleagues from Rhode Island, but with RPE folks and their community partners, the Trans Action Coalition. We're really looking forward to learning about some of the great policy work they've been able to accomplish through community. So thank you all so much. This will end. I don't know another word for end. This will conclude our session for today, and we hope to see you on Wednesday. Thanks.